Good. Normally हम क्या देख रहे हैं कि every cranial nerve is usually coming from the ventral part. पीछे की तरफ से आ रही है. The only cranial nerve which arises directly dorsally over here, it is nothing but your fourth cranial nerve, also known as your trochlear nerve. तो इसमें ये भी डायरेक्टली पूछा गया है. The only cranial nerve which arises dorsally from the brainstem area, answer is straight away fourth cranial nerve or your trochlear nerve. Once they have marked this image and they have asked that which is this nerve arising from the brainstem area, answer should be the fourth cranial nerve. No issues with this, anybody? Very clear? Jaldi se cranial nerve. Cranial nerve number 1 is known as olfactory nerve. ऐसे याद रखना है. नाक कितनी है तुम्हारी? एक. So cranial nerve number 1 is olfactory nerve. Cranial nerve number 2 है. आंखें कितनी है? दो. So cranial nerve number 2 is optic nerve. Cranial nerve number 3, oculomotor nerve. Cranial nerve number 4, clear nerve. Cranial nerve number trigeminal nerve. Cranial nerve number 6, abducens nerve. Cranial nerve number 7, facial nerve. Cranial nerve number 8, vestibulocochlear nerve. Cranial nerve number 9, glossopharyngeal nerve. Cranial nerve number 10, vagus nerve. Cranial nerve number 11, accessory nerve. And cranial nerve number 12, hypoglossal nerve. No issues with this, anybody? That's the important. Smallest cranial nerve, jaldi se. मैं important one liners करवा रहा हूँ. Smallest ray. ENT पढ़ी है ना सब लोगों ने? Very good. Olfactory. So the smallest cranial nerve will be the olfactory cranial nerve. Please remember, the smallest cranial nerve is the olfactory nerve, which is the longest cranial nerve. Longest cranial nerve will be the vagus nerve. That is your 10th cranial nerve. Another question which has been asked in your exam. Longest intradural course. Very good. Longest intradural course is seen with which nerve? It is the 6th cranial nerve known as the abducens nerve. Please remember. Therefore, in cases of meningitis, which is the earliest nerve to be affected? That was the question, applicant. 6th cranial nerve. Reason is because it passes between the meninges. Okay. So please remember that's important is longest intradural course is of the 6th cranial nerve, also known as your abducens nerve. So therefore, in any case of meningitis or raised ICP, the earliest and the most common nerve to be affected should be by default the abducens or the 6th cranial nerve. Logic hai. Okay? Next, if they ask you the longest intracranial course, jaldi se. Very good. The longest intracranial course is seen with the 4th cranial nerve, also known as your trochlear nerve. Okay? No issues with this. The largest or the thickest nerve, if they ask you. Very good. The largest or the thickest cranial nerve, answer is very easy. It is nothing else but your trigeminal nerve. It is your 5th cranial nerve. How many branches does the trigeminal nerve gives? 3 branches. First division is ophthalmic. Second is maxillary. And third is mandibular. No issues with this, anybody? That's the reason why it is the thickest or the largest cranial nerve. कोई दिक्कत नहीं है इसमें. Last one, the longest intradural course, intraosseous course. Very good. So the longest intraosseous. Intraosseous का मतलब क्या बच्चों? Within the bone. कौन सी ऐसी नर्व है जो सबसे लंबा रास्ता बोन के भीतर, बोन के अंदर तय करती है? It is nothing but your 7th cranial nerve or your facial nerve. ठीक है? So these are the important one-liners which have come from cranial nerve. जल्दी से, smallest cranial nerve is olfactory. Longest cranial nerve is vagus nerve. Longest intradural course is seen with abducens nerve. Longest intracranial course is seen with trochlear nerve. Largest or thickest nerve is, and longest intraosseous nerve is facial nerve. No issues with this, anybody? So remember, ये trochlear वाला question सरकारी है, 2 या 3 बार question exam में आ चुका है. So please remember, only nerve which arises from the dorsal aspect of your brain stem. That's the question. Okay, moving further. Question number 2. It states corticospinal tract crosses at the level of. Very good. It crosses at the level of lower medulla. So answer to this question is option number C. Let's see the tracts once. Jaldi se. Now this is the cut section or the cross section of your spinal cord. Okay? कट सेक्शन या क्रॉस सेक्शन ऑफ योर स्पाइनल कॉर्ड में ये जो बीच में निकाल रहा हूं ये क्या है? सेंट्रल केनाल. क्या पास करता है सेंट्रल केनाल से? CSF, दैट इज सेरेब्रो स्पाइनल फ्लूइड. ठीक है, नो इश्यूज विद दिस. नाउ डेफिनेटली दिस ग्रे मैटर दैट यू कैन सी इट इज एस शेप्ड यूजुअली, एंड इसके अलावा ये बाहर जितना भी एरिया है दिस इज नथिंग बट योर व्हाइट मैटर. व्हाइट मैटर इज डिवाइडेड इनटू 3 कॉलम्स. कौन से 3 कॉलम दिख रहे हैं? फर्स्ट इज डॉर्सल कॉलम, सेकंड इज lateral column, and third is anterior column. No issues with this, anybody? Now important is, if I talk about tracts, what are tracts? Definitely tracts are the structure which connect the brain to the spinal cord. ठीक है, so जो structures, the structures which will connect the brain to the spinal cord, these are known as the tracts. वो ऊपर की तरफ जाएंगे then they will be called as ascending tracts. Very good. And when they come downwards, they will be called as descending tracts. No issues with this. Important is that the dorsal column or the posterior column only has ascending tracts. The dorsal or the posterior column only has ascending tracts. But the lateral and anterior column will have both ascending as well as descending tracts. Now, please tell me that ascending tracts, which are going from spinal cord to the brain, these will be sensory or motor? These will be sensory. Why? Because they are carrying sensations from the spinal cord to the brain. Whereas descending tract, जो brain से नीचे आ रहे हैं, they will definitely be motor. They will definitely be motor. No issues with this, anybody? Important is that. Now let's talk first of all about the descending tracts. Usually descending tracts are only present in 2 columns. One is the lateral column and another is the anterior column. Lateral column mein, now these tracts are starting from where? They are starting from the brain and they are coming to the spinal cord. Which part of the brain? The outer part of the brain known as cortex. So as they are starting from cortex and coming towards the spinal cord, these should be called as corticospinal tract. So by default, we have first descending tract as lateral corticospinal tract and second corticospinal tract as anterior corticospinal tract. Both of these are motor or sensory? Both of these are bachcho descending tracts. They are coming downwards. So therefore both of them will be motor. And they will carry which function? They are responsible for which function? Anybody? सेंसेशन खुद नहीं बोल रहे हो तो पेन कैसे आएगा? The skilled voluntary movements which are there, please remember these are motor movements ना. तुम लिख रहे हो, तुम खा रहे हो, तुम चल रहे हो, all of these voluntary movements that you are doing, they are due to these corticospinal tracts which are bringing signals down to the from the brain to the spinal cord. Okay, so that's important. So usually please remember the descending tracts, they are motor or sensory? Motor. They are lateral and anterior. They are known as corticospinal tracts. They are responsible for which movements? Skilled voluntary movements. Important. Now they pass via the medulla. And they pass via which part of the medulla? Central part of medulla is known as pyramid. And lateral part of medulla is known as olives. Therefore, these pass via the central part. Therefore, these tracts can also be called as bus. So the corticospinal tracts are also called as pyramidal tracts. That's what you need to remember. The corticospinal tracts can also be called as pyramidal tracts. Why? Because they pass via the medullary pyramids itself. These was about the descending tract. जो ऊपर से कहाँ रहे? नीचे. अब जो नीचे से ऊपर जाएंगे, these will be called as the ascending tracts. They are present in 2 columns or 3 columns. They are present in all the 3 columns. Now they are starting from where? Spinal cord and going where? Towards the brain. Which part of the brain? But thalamus. Therefore, these should be called as spinothalamic tract. No issues with this. The one which is present in the dorsal column should be called as dorsal column tracts, or we can call them as fasciculus cuneatus and fasciculus gracilis. Fasciculus is nothing but a bundle. Fasciculus का मतलब ही होता है bundle. Okay, so fasciculus cuneatus and fasciculus gracilis are present in which column of the spinal cord? Dorsal or the posterior column of the spinal cord. They are ascending or descending in nature? Ascending in nature. So they are responsible for sensory or motor function? Sensory function. कोई दिक्कत नहीं है? Perfect. The next important is, please remember, the lateral tract definitely. The lateral ascending tract. This will be called as lateral spinothalamic tract. And anterior ascending tract will be called as anterior spinothalamic tract. Now lateral and anterior spinothalamic tract which are there, usually they are sensory or motor? Again they are sensory itself. ठीक है? That's important. तो now कौन से sensations carry करते हैं ये जल्दी से याद रखना है, important है. सबसे पहले तो lateral वाला easy है. Lateral spinothalamic tract will carry, they carry two sensations. One is pain and second is temperature. Okay, mnemonic can be remembered as PCT. Why? Because please remember, pain and temperature they carry always contralateral. That means याद रखना, sorry, याद रखना अगर तुम्हारे राइट हाथ में एंड राइट पैर में अगर तुम्हें पेन सेंसेशन से टेम्परेचर महसूस नहीं हो रहा है, दैट मींस किस साइड के ट्रैक डैमेज है तुम्हारे? लेफ्ट साइड के लैटरल स्पाइनोथैलेमिक ट्रैक डैमेज है. तो प्लीज रिमेंबर, पेन एंड टेम्परेचर सेंसेशंस आर ऑलवेज एंड ऑलवेज contralateral. PCT is the mnemonic. And second important easy mnemonic, लात जब पड़ती है तो क्या होता है तुम्हें? गुस्सा आता है. ओके, तो सबसे पहले गुस्सा आता है तो टेम्परेचर बढ़ता है और दर्द होता है तो पेन. ठीक है, सो दैट्स हाउ यू रिमेंबर इट. लात स्पाइनोथैलेमिक ट्रैक्ट आर नोन टू कैरी पेन एंड टेम्परेचर. ठीक है, सो दैट्स हाउ इजीली इट कैन बी रिमेंबर्ड. नेक्स्ट इज anterior spinothalamic tract, guys. Now anterior spinothalamic tract are known for which sensations? Crude touch या fine touch? Crude touch. तो कैसे याद रखना है? आंटी वाला टच कैसा होता है? क्रूड होता है, फाइन होता है? जो देखो एक्सपीरियंस वाले बोल गए, ऐसा ही होता है. तो प्लीज रिमेंबर, इट यूजुअली कैरीज द क्रूड टच एंड सेकेंड इंपॉर्टेंट इज इट कैरीज द प्रेशर. ठीक है, तो एंटीरियर स्पाइनोथैलेमिक ट्रैक्ट, एंटी वाला टच इज क्रूड एंड डेफिनेटली इट विल ऑल्सो कैरी प्रेशर. बचता क्या है? बस तुम्हारा डोर्सल कॉलम. इंपॉर्टेंट इज डोर्सल कॉलम में कौन से थे? असेंडिंग ट्रैक्ट्स, दे वर कॉल्ड एज fasciculus cuneatus and fasciculus gracilis. These are known to carry which sensations? These are known to carry, first of all, easy वाले करो. कौन सा टच? Fine touch. Crude touch by anterior, fine touch by dorsal. Important. Then which sense? Vibration sense usually. It also carries vibration sense. Next, joint position, also known as proprioception. Proprioception is nothing but joint position. ठीक है, last one is stereognosis. Stereognosis क्या होता है? Inability to identify objects with closed eyes only by touching them. ठीक है, so that's important. That is carried by dorsal spinothalamic tracts, also called as fasciculus cuneatus and fasciculus gracilis. So jaldi se, if I take a cut section of spinal cord, I have three columns: dorsal, lateral and anterior. कौन सा एक कॉलम है जहां से बस ascending tracts पास होते हैं? Dorsal column. Ascending tract, they go from spinal cord to brain. Therefore, they are called as spinothalamic tract. They carry sensory function or motor function? Sensory function. Shabash. Then descending tracts, they come from brain to the spinal cord. Therefore, they will be called as corticospinal tract. They are present in all the three columns. Important. Corticospinal, they are present only in anterior and lateral column. Corticospinal tracts are known to carry sensory function or motor function? Motor function. They are responsible for skilled voluntary movements. No issues with this? Jaldi se. Dorsal column is known to carry four sensations. First is which touch? Crude or fine? Fine touch. Kaun sa sense? Vibration sense. Joint position known as proprioception. And last is stereognosis. Whereas the lateral spinothalamic tract, लात पड़ती है तो क्या होता है? Pain and temperature. Pain and temperature are always ipsilateral or contralateral? Always contralateral. Very good. Anterior spinothalamic tract, it is known to carry crude touch and pressure. That's the important thing. कोई दिक्कत नहीं है इसमें? These are the easy things. ठीक है, तो ज्यादा भसड़ में पढ़ना नहीं है. These are the easiest way that you can remember the tracts and their function. Usually questions come from function because it is not only a question of anatomy but also physiology as well. ठीक है, so that's important. और बहुत बार तो डायरेक्ट स्ट्रेट अवे क्वेश्चन आता है और ये चीज से इतना डर लगता है कि लोग जाते ही नहीं है इसमें. This is the easiest thing that you need to remember. Don't go into details. Nothing is required. Important is now there are three meninges covering the brain and spinal cord. The innermost is called as pia mater, arachnoid matter. Most is called as dura mater. Is outside dura mater will be called as extradural space or epidural space. Space below dura mater will be called as sub space. Space below arachnoid will be called as sub arachnoid space. कोई दिक्कत नहीं है. Now, what is present in the sub arachnoid space? CSF, that is your cerebrospinal fluid. Another important question. Cerebrospinal fluid is formed by Shabash. So CSF definitely is formed by what? Choroid plexus. Plexus का मतलब क्या होता है बच्चों? नेटवर्क. राइट, प्लेक्सस का मतलब होता है नेटवर्क. तो ये किसका नेटवर्क होता है? कैपिलरीज का. तो फॉर्म बाय अल्ट्रा फिल्ट्रेशन ऑफ ब्लड. ठीक है, तो अल्ट्रा फिल्ट्रेशन ऑफ ब्लड या प्लाज्मा जब होता है तो द रेसिड्यू दैट यू गेट इज नॉट. ठीक है, सो दैट्स इंपॉर्टेंट थिंग. प्लीज रिमेंबर अल्ट्रा फिल्ट्रेट ऑफ ब्लड और प्लाज्मा. इट इज फॉर्म बाय विच स्ट्रक्चर? कोरोइड प्लेक्सस. कोरोइड प्लेक्सस इज प्रेजेंट वेयर? Which ventricles? Shabash. Lateral ventricles. Now, these lateral ventricles are nothing. You can just remember they are extension of the subarachnoid space. ये सब connected होते हैं एक दूसरे. ठीक है, तो याद रख सकते हो. तो usually CSF is formed in which ventricles? Lateral ventricles by a structure or capillary network known as choroid plexus. From lateral ventricles, they will go into third ventricle. Shabash. They will go into the third ventricle. From third ventricle, they will go in. It will go into the fourth ventricle. Okay, and from fourth ventricle it will have 2 feet. मतलब दो चीजें हो सकती है उसके साथ. Some amount of it, 1/3 of it will go into the 1/3 of it will go into the central canal. और अभी देखा central canal कहाँ होता है? Spinal cord में, right? And 2/3 of it goes into the subarachnoid space. 2/3 goes into the subarachnoid space. Subarachnoid space mein finally it goes and it will be absorbed by, that is another question, it will be absorbed by the arachnoid villi. Very good. Or granulations we can call them as well. Okay, they will be absorbed by arachnoid villi and granulations and finally it will go into the veins. मतलब artery capillary से निकल रहा है और finally veins में जा रहा है. ठीक है, so that's the important thing. Now important is from lateral ventricles it forms and it comes into the third ventricle via a foramen known as foramen of Monroe. ठीक है, very good. It is foramen of Monroe. Please remember. Now from third ventricle it comes into the fourth ventricle via aqueduct and that aqueduct is known as aqueduct of Sylvius. Shabash. Now from fourth ventricle, okay, it goes into the subarachnoid space via foramen of Hushke and foramen of Magendie. Very good. So it goes into the subarachnoid space via the foramen of Hushke and foramen of Magendie. ठीक है, तो जल्दी से now. CSF is formed by which structure? The capillary network known as choroid plexus. Choroid plexus is present in which ventricles? कितनी lateral ventricles होती है? 3 किसकी है भाई? एक्स्ट्रा है क्या? तो 2 lateral ventricles होगी. ठीक है, from lateral ventricles it will go into the third ventricle via foramen known as foramen of Monroe. From third ventricle it will go into the fourth ventricle via aqueduct known as aqueduct of Sylvius. From fourth ventricle it will go 1/3 will go into the central canal of spinal cord and 2/3 will go into the subarachnoid space via the foramen of Hushke and foramen of Magendie. कौन से दो foramen? Foramen of Hushke and foramen of Magendie. Finally, in the subarachnoid space, CSF will be absorbed back by arachnoid villi and arachnoid granulation. कोई दिक्कत नहीं है इसमें. That's it. ठीक है, और ये यही मार्क करके भेजते तुम्हें. तो ये देख लो इजीली, मैं हाईलाइट कर रहा हूं. अब तुम्हें ये पता है ये ब्लू वाला कौन सा होना चाहिए? लैटरल वेंट्रिकल. उसमें जो कैपिलरी नेटवर्क हाईलाइट किया है दैट इज योर कोरोइड प्लेक्सस. ठीक है, यहां CSF बना. देन इट शुड कम इनटू दिस वेंट्रिकल. ये कौन सी वेंट्रिकल है? It is the third ventricle. Okay, so third ventricle से सॉरी lateral ventricle से third ventricle तक कहां से आया? By the foramen of Monro. So this interventricular foramen is nothing but foramen of Monro. Next, from third ventricle, it should go into the, तो ब्रेन स्टेम में होती है फोर्थ वेंट्रिकल. ठीक है बच्चों, ये देखो, अगर ब्रेन स्टेम में कुछ हाईलाइट करते हो वो, देन यू नीड टू रिमेंबर दिस इज द फोर्थ वेंट्रिकल. ओके, सो दिस फोर्थ वेंट्रिकल में कहां से आया? एक्वेडक्ट. कौन सी एक्वेडक्ट? एक्वेडक्ट ऑफ सिल्वियस. ठीक है. नाउ फ्रॉम फोर्थ वेंट्रिकल, 1/3 is going down into the central canal and 2/3 is going into the subarachnoid space. ये ब्लू वाली जो दिख रही है, it is what is your subarachnoid space. ठीक है, and it is going via this foramen of Hashke and foramen of Magendie. No issues with this anybody? That's it. और ये arachnoid granulation जो absorb कर लेंगे उसको वापस in the subarachnoid space. ठीक है, so that's it. ठीक है, so these are the bare minimum things जो मैं तुम्हें already discuss कर रहा हूँ. This is about the decussation. Decussation का क्या मतलब होता है? एक बार decussation पूछ लिया crossing की जगह, people were confused. तो decussation का मतलब बच्चों nothing else but crossing itself. ठीक है, तो decussation means crossing. Decussation means crossing. Which tracts will cross usually? The pyramidal tracts. Pyramidal tracts are also known as corticospinal tracts. Corticospinal tracts are ascending or descending tracts? They are descending tracts. And descending tracts are only present in two columns. One is the lateral column and second is the anterior column. They are sensory in function, motor in function, and they carry skilled voluntary movements. कोई दिक्कत नहीं है. Important is these tracts usually cross at the level of, क्या दिख रहा है, कहाँ क्रॉस कर रहे हैं? At the level of the medulla. At which part of medulla? Upper or lower? Lower part of medulla. ये क्वेश्चन दो बार ऑलरेडी पूछा जा चुका है in FMG exam, so don't make a mistake now. Corticospinal tracts cross at which level? Lower medulla. Okay, corticospinal tracts are also known as pyramidal tracts. So don't get confused if they say pyramidal decussation. It is one and the same thing. They will either say corticospinal decussation, that is corticospinal crossing, or pyramidal decussation, that is pyramidal cross. That's one and the same. कोई दिक्कत नहीं है इसमें. चलो, जो तुम्हारा फेवरेट क्वेश्चन है स्पाइनल कॉर्ड वाला, वो आगे आएगा, इसलिए नहीं डिस्कस कर कौन सी लेवल पे. इंपॉर्टेंट क्वेश्चन नंबर 3 नाउ. इस सब्जेक्ट में तो सबकी हालत टाइट है ना? तो इंपॉर्टेंट है इस सब्जेक्ट का क्या पढ़ना है, मैं बता रहा हूं. क्लिनिकल्स, बस कम से कम इस सब्जेक्ट के पूरे क्लिनिकल्स रट लो. और कौन थे वो लोग जो, बताओ, गाउशर्स का क्लिनिकल केस नहीं आया? जाके देखा कितने के एग्जाम्स में गाउशर्स का क्लिनिकल केस था? तो गाउशर्स का क्लिनिकल केस नीट पीजी में ही नहीं, एफएमजी में भी बहुत बार पूछा गया है. ठीक है, सो दैट्स इंपॉर्टेंट. गाउशर्स, वॉन गियरकीज, लेशनेहान, ये जो तुम्हें दिए, फिनाइलकीटोन्यूरिया, एल्केप्टोन्यूरिया, ये 5 डिसीजेस के क्लिनिकल केसेस आते हैं. बस एंजाइम डेफिशिएंसी नहीं पूछते. इनके अलावा बाकी सबकी एंजाइम डेफिशिएंसी. इनके अलावा बाकी किसी का कुछ रटो भी मत, मैं खुद बोल रहा हूं. बाकी सबका बस एंजाइम डेफिशिएंसी का नाम रट लो. इन डिसीजेस के तुम्हें सिम्टम्स भी पता होने चाहिए, देन यू विल बी एबल टू मेक अ डायग्नोसिस. ठीक है, चलो ना. हियर वी हैव अ क्वेश्चन. इट सेज a 8-month-old child, okay, presents with hypoglycemia in between feeding. Okay, whenever he is not fed, that means during the fasting stage he goes into hypoglycemia, that is decreased blood glucose levels. On examination there was hepatomegaly. What is hepatomegaly? Enlargement of liver. ठीक है, and the liver was palpable 1 centimeter below the subcostal margin. ये होती है subcostal margin, इससे नीचे 1 centimeter, मतलब the liver has been enlarged. The child also presents with lactic acidosis, ketosis, and xanthomas on the buttocks. What's the most likely enzyme deficiency leading to this? Important. डायरेक्ट क्वेश्चन, डायरेक्ट आंसर पे जाते क्या अपन? नहीं. तो पहले क्या बनाओगे? प्रोविजनल डायग्नोसिस. बताओ क्या लग रहा है? शाबाश. सो इट इज अ केस ऑफ वॉन गियरकीज डिसीज. वॉन गियरकीज डिसीज इज विच टाइप ऑफ डिसऑर्डर? एनीबडी? Glycogen storage disorder. Which type of glycogen storage disorder? Type 1 glycogen storage disorder. And it is also the most common type of glycogen storage disorder. Von Gierke's disease, as this enzyme deficiency is present since birth itself, therefore it will be more common in children usually. ठीक है? So please remember, if they ask you which is the most common glycogen storage disease, answer should be Von Gierke's disease. If the question is most common glycogen storage disease in children, answer should be again Von Gierke's disease itself. It is type 1 glycogen storage disease. क्यों बनाया Von Gierke's? in one gear keys definitely. Now glycogen storage disease का मतलब क्या होता है? Please remember. Now glycogen storage form of glucose in your body. Glycogen is only stored in two organs of your body. ये question था. Liver and muscle. Only two organs in your body can store glycogen. First is liver and second is muscle. Important is, please remember, whenever you need glucose from this glycogen has to be broken down. That is called as glycogenolysis. Important is, for this many enzymes are required, and if these enzymes are deficient, वो glycogen breakdown होगा क्या? नहीं होता. And therefore all that glycogen will keep on collecting usually inside your body. Now this excess of glycogen will deposit inside the liver, inside the muscles, sometimes rarely in the brain. Okay? So as it deposits in the liver, what will happen? There will be hepatomegaly. Okay? As it deposits in the muscle, the patient will suffer from muscle weakness usually. Okay? So these are the issues that the patient usually faces. And definitely if the patient is not given food, he goes into which state? Fasting या starvation? पहले fasting state में, right? And in fasting state definitely, what is the source of blood glucose? During fasting state, what is the source of blood glucose? Glycogen. Fasting is 12 to 18 hours without food. Understand? 12 से 18 घंटे without food is called as fasting. And in fasting state, the source of blood glucose is nothing else but your glycogen itself. ठीक है? So usually it is nothing but the glycogen definitely. So if the patient is not given food, so he only and only depends on glycogen. And अगर glycogen breakdown नहीं हो पाएगा, इस patient में glucose आएगा क्या? नहीं आता. And therefore what will he suffer from? Hypoglycemia. That what happens in von Gierke's disease. As the enzyme is deficient, glycogen cannot be broken down, and therefore the blood glucose levels could not rise, and therefore the patient has hypoglycemia. Is it severe, mild? Severe. Mild किसमें होता है फिर? Anybody? Von Gierke's disease, and the type 6 is known as Hirsch disease. What is the enzyme deficiency in von Gierke's? Glucose 6 phosphatase. Whereas what is the enzyme deficiency in Hirsch? Hepatic glycogen phosphorylase. Okay, important is that. Now in both these conditions, if the glycogen is not broken down, where it will collect? It will collect in both the conditions. It will collect in the liver itself. Therefore, in both the conditions, the child will have hepatomegaly. How to differentiate? Now, this glucose 6 phosphatase, guys, is it the enzyme only required for glycogen breakdown? It is the enzyme only required for glycogen breakdown. What? और का यूज होती है? Very good. It is also an enzyme which is required for gluconeogenesis. And I hope all of you are quite aware. If glycogen cannot be broken down, then our body tries to synthesize, or it will try to form new glucose, and that process is known as gluconeogenesis. Now this enzyme is required for glycogenolysis as well as gluconeogenesis. अगर patient में glycogenolysis नहीं होता, at least he would have got blood glucose from gluconeogenesis. इस patient में दोनों होगा क्या? Because the main enzyme is deficient, so he'll not have glycogenolysis as well as he'll not have gluconeogenesis. That's the reason he'll have severe hypoglycemia or mild hypoglycemia. Severe hypoglycemia. When there is severe hypoglycemia, your brain definitely needs energy. So if it is not getting glucose, it will depend on ketone bodies. So your liver tries to prepare what? Ketone bodies for your brain. Okay, mainly. So definitely, what will happen? There will be production of more and more ketone bodies. That's the reason why the patient will have ketosis. Okay, the patient will have ketosis. Please remember that. Okay, important is in cases of severe hypoglycemia, when the glucose is broken down, your body is already in severe hypoglycemia. Will it need glucose rapidly या time चल सकता है? Rapid चाहिए ना? तो अगर rapid चाहिए, will it carry out anaerobic glycolysis or aerobic glycolysis? Anaerobic glycolysis. Anaerobic का मतलब वो ठीक है, बट बनता क्या है फाइनली? लैक्टिक एसिड। तो याद रखना, anaerobic glycolysis is faster and your body needs fast blood glucose. Therefore, it carries out anaerobic glycolysis. That's the reason why the patient will have more and more lactic acid production that will cause lactic acidosis. That's how you can differentiate, because in cases of HERS disease, that is type 6 glycogen storage disorder, the patient will only have mild hypoglycemia. Q anybody? Because this hepatic glycogen phosphorylase is only an enzyme required for glycogenolysis. ग्लूकोनेोजेनेसिस होगा क्या इस बच्चे में? होगा, क्योंकि उसकी एंजाइम तो डेफिशिएंट है क्या? तो इस बच्चे में ग्लूकोनियोजेनेसिस होता है, इसीलिए द पेशेंट ओनली हैज माइल्ड हाइपोग्लाइसीमिया. As there is only mild hypoglycemia, will there be ketosis? No. Will there be lactic acidosis? No. That's how you differentiate between type 1 and type 6, and this was a previous year FMG question. ठीक है? And hepatic glycogen phosphorylase was also in the option. So that's the important thing. अगर उन्होंने एक क्वेश्चन अगर उन्होंने ये दो सिम्टम्स नहीं दिए, आंसर कैन बी टाइप 6 also. Please remember that. ठीक है? So that's the reason I'm telling you that these are the keywords to be picked up. It is the lactic acidosis and ketosis along with severe hypoglycemia in the child, which is making the diagnosis of type 1 glycogen storage disease known as von Gierke's disease. It is due to a deficiency of nothing else but option B, glucose 6 phosphatase. And here, as I've told you, as the child is having hypoglycemia, brain will not get enough amount of glucose, तो brain पागल हो जाएगा, and फिर क्या होगा patient में? Seizures. The patient will have coma, and the child is having prolonged hypoglycemia. मिल ही नहीं रहा उसके brain को glucose, तो काम करेगा क्या? नहीं. So the child will have mental retardation, also called as intellectual disability. Along with that, the child will also have doll-like faces. Characteristic है von Gierke's की, doll-like faces. ठीक है? So doll-like faces are seen in which condition? Von Gierke's disease. They will mention it in the question a lot of times. So please pick up that keyword. Next, hepatomegaly. Okay, that will cause distension of abdomen. And yes, there can be glycogen accumulation even in the kidneys. That can also cause kidney enlargement in the patient as well. ठीक है? So please remember this along with the other features. This is the बच्चा. कैसा दिख रहा है face? Doll-like faces. कैसे दिख रही है abdomen? Distended due to hepatomegaly. You can see this is the margin of liver that has been marked. तो इतनी बड़ी liver है उस बच्चे की. ठीक है? जल्दी से बाकी के glycogen storage diseases. Type 1 is known as von Gierke's. It is the most common. Enzyme deficiency was glucose 6 phosphatase. Glycogen accumulation only occurs inside the liver. Type 2 glycogen storage disease is also known as Pompey's disease. It is the only lysosomal storage disorder. So this was a previous year question. Only glycogen storage disease, which is also a lysosomal storage disorder. Answer should be type 2. That is nothing else but Pompey's disease. And the enzyme deficiency is known as acid maltase deficiency. Okay. Next, type 3 and type 4. Easy hai? Type 3 is C. Okay. So type 3 is Cory's disease, also known as Forby's disease, also known as limit dextrinosis. And the enzyme deficiency will be called as D branching enzyme. So C में क्या आता है? D. Type 4 is known as Anderson's disease, also known as amylopectinosis. And the enzyme deficiency will be branching enzyme. तो easy है ये याद रखना कैसे? C में आता है D और A में आता है B. तो type 3 is known as which disease? Cory's disease. And the enzyme deficiency is D branching. Type 4 is known as Anderson's disease. And the enzyme deficiency is branching. Shabash. Type 5 is known as McArdle's disease. And important, the enzyme deficiency is known as muscle glycogen phosphorylase. Okay, the enzyme deficiency is known as muscle glycogen phosphorylase. Okay, here the glycogen will only and only accumulate inside the muscles, and therefore the patient will only have muscle weakness. Last is type 6, also known as HERS disease. The enzyme deficiency we discussed, it is known as hepatic or liver glycogen phosphorylase. Here the glycogen will only and only collect inside the liver. So ऐसे दो glycogen storage disease where there is collection only inside liver, type 1 and type 6. Severe hypoglycemia and type 1, mild hypoglycemia and type 6. Easy. No issues with this. Type 2, 3 and 4 में there is collection of glycogen in the liver, muscle and brain. And which is the only glycogen storage disease where there is only collection of glycogen in the muscle? Type 5, that is McArdle's disease. कोई दिक्कत नहीं है. मैसिव हेपेटोमेगली वॉन गिरकीज में दिखती है. ठीक है, उसमें ज्यादा होता है, सीवियर है ना, इसीलिए ज्यादा दिखता है. ठीक है, नो इश्यूज विद दिस एनीबॉडी. तो ये टेबल पहला जो याद रखना है. अलोंग द वे आई टेल यू कि व्हिच आर द इंपॉर्टेंट थिंग्स टू बी रिमेंबर्ड. नेक्स्ट इज क्वेश्चन नंबर 4. इट सेज अ न्यूबॉर्न डेवलप्स vomiting, irritability and lethargy several days after birth. His mother stated that his diapers, ये characteristic है, smell like burnt sugar. Burnt sugar is nothing else but caramel, or it will also smell like maple syrup. So his urine is smelling like what? Burnt sugar, also known as caramel. Also it will be similar to maple syrup smell or maple syrup odor. अपने यहाँ नहीं खाते usually. In USA they eat a lot maple syrup. ठीक है? Laboratory studies confirm the diagnosis and the patient is started on the appropriate dietary restrictions with subsequent improvement in his symptoms. The defective enzyme responsible for this patient's condition is known as. Provisional diagnosis is very good. MCUD, that is maple syrup urine disease. The child's urine will smell like maple syrup or smell like caramel or smell like burnt sugar. One and the same thing. कुछ भी दे वो answer question में. ठीक है? Important is that. Now, maple syrup urine disease is also an inborn error of metabolism. It is due to which enzyme deficiency? BCKD. That is nothing else but branch chain alpha keto acid dehydrogenase. We can also call it. Don't get confused if they change the name to branch chain alpha keto acid decarboxylase. It is one and the same enzyme. क्योंकि उसी स्टेप में decarboxylation भी होता है, dehydrogenation भी होता है. ठीक है? So that's the important thing. No issues with this. So the enzyme deficiency in maple syrup urine disease. Answer is BCKD. That is branch chain alpha keto acid dehydrogenase or decarboxylase. Now important is, if there is deficiency of BCKD enzyme, which amino acids will not be broken down? What are these? Very good. So branch chain amino acids will not be broken down. क्यों? क्योंकि उनको जो break down करने वाली enzyme है वो क्या है इस patient में? Deficient है. Therefore all these branch chain amino acids will keep on collecting inside the patient's body. And what are these branch chain amino acids? Live. That is leucine, isoleucine and valine. Okay, leucine, isoleucine and valine. So if they ask you which amino acid should not be given in this patient's diet, answer should be live. That is leucine, isoleucine and valine. क्यों इन तीन अमाइनो एसिड्स को नहीं देना है बच्चे की डाइट में? Because they will not be broken down. They will keep on collecting inside the patient's body. ठीक है? क्यों collect होंगे? Because the enzyme responsible for the breakdown is absent or it is deficient. ठीक है? तो बेसिक याद रखना है, हमेशा आप एंजाइम डेफिशिएंसी नहीं पूछेंगे, वो ये भी घुमा के पूछ सकते हैं कि which amino acid should not be given in the patient's diet. That's it. Easy है वो. ठीक है? So that's important, you need to remember. Now if the patient is having deficiency of isovaleril coenzyme A dehydrogenase, then the patient develops what? क्या हुआ? डिसीजेस के नाम मैंने ही बोला ना, कम से कम क्लिनिकल्स. मैं जा ही रहा हूं क्या पाथवे में? नहीं ना, मैं बस डिसीजेस के नाम और एंजाइम डेफिशिएंसीज बोल रहा हूं. Isovaleric acidemia or isovaleric aciduria. Okay, now what happens in this patient is excess of leucine. नाम में isovaleric है, but excess of leucine gets collected in the patient's body. Okay, and excess of leucine is present inside his blood. That will be called as isovaleric acidemia. And excess of leucine will be excreted out in his urine. Therefore, it is called as isovaleric aciduria. It is one and the same thing. So it is only due to collection of which amino acid in the body? Only leucine. Only leucine. ठीक है? The enzyme deficiency is known as isovaleril coenzyme A dehydrogenase. ठीक है? Important is that. No issues with this. Important. इसमें भी यूरिन का एक पर्टिकुलर और पेक्यूलियर ओडर होता है. कैसा होता है? एनीबडी? It is usually cheesy or sweaty feet like. Sometimes we can even call it cabbage like. Okay, it's one and the same thing. Okay, so please remember isovaleric acidemia or isovaleric aciduria. Which kind of urine odor will be there? चीजी और स्वेटी फीट. जब सॉक्स उतारते हो दिन भर की थकान के बाद कैसी स्मेल आती है, वैसी आती है. ठीक है, तो प्लीज रिमेंबर चीजी और स्वेटी फीट लाइक यूरिन ओडर इज सीन इन विच कंडीशन? Isovaleric acidemia. Isovaleric acidemia में there is excess collection of which amino acid in the body? Leucine, and it is due to enzyme deficiency known as isovaleril enzyme A dehydrogenase. कोई दिक्कत नहीं है. तो अगली बार अगर बर्न शुगर या कैरमल की जगह स्वेटी फीड या चीजी ऑर्डर आया तो डायग्नोसिस शुड बी आइसोवेलरिक एसिडीमिया एंड एंजाइम डेफिशिएंसी शुड बी आइसोवेलरिल कोएंजाइम ए डीहाइड्रोजिनेज. एंड कौन सा अमाइनो एसिड नहीं दोगे इस पेशेंट में? ओनली ल्यूसीन. ठीक है, चलो आगे बढ़ते हैं. मूविंग फर्दर, फिनाइलएलैनिन हाइड्रोक्सिलेज बता दो कौन सा डिसीज करेगा? कौन अल्केप्टोन्यूरिया वाला है बे? Phenylalanine hydroxylase deficiency causes phenyl ketone urea in the patient. It causes phenyl ketone urea in the patient. Please remember. ठीक है, तो phenyl ketone urea में the enzyme deficiency is known as phenylalanine hydroxylase. Okay, please remember this. Question number 5 now. A 73-year-old woman comes to the physician because of a 2-month history of diffuse weakness and tingling sensation of her arms and legs. Neurological examination shows weakness of the extensor and the flexor muscles of the lower extremities. Sensation to vibration as well as position is decreased in all extremities. The patient is most likely has a deficiency of which of the following vitamin? Now important is याद रखना कि vitamins most essential part of biochemistry. जिसको विटामिन अच्छे आ गए उसने 5 क्वेश्चन एग्जाम में इजीली सॉल्व कर लिए. यस, मिनिमम 5 थिंग, नॉट मैक्सिमम. 5 क्वेश्चन. एक एग्जाम तो दिसंबर वाला 2021 ऐसा था जिस 3 क्वेश्चन विटामिन B12 के ही थे. ठीक है, तो इतना इंपॉर्टेंट होते हैं विटामिन. प्लीज रिमेंबर दैट. इंपॉर्टेंट इज यहाँ पे elderly patient coming to us with weakness of the muscles. Along with that, there is tingling sensation. Anybody? Muscle weakness and tingling sensation are usually suggestive of neuropathy in the patient. Where the patient has neuropathy? In all the extremities. So it is a central or a peripheral neuropathy. So the patient is having a peripheral neuropathy. Up tak theek hai. But now they are saying that the sensation to vibration and position is also decreased. Now vibration sense and position sense are carried by dorsal column of your spinal cord, right? The fasciculus cuneatus and fasciculus gracilis, right? That means here the only peripheral nerves are affected or spinal cord is also affected? Spinal cord is also affected now. This vitamin deficiency is causing severe neurological symptoms in the patient and therefore it is causing nothing else but subacute combined degeneration of spinal cord. And the most common column to be damaged over here is nothing but posterior column, and therefore all the functions of the posterior column will be decreased. That is also known as proprioception, vibration, sense, then fine touch usually, and lastly stereognosis. All these will be affected. Okay, along with peripheral neuropathy, if they are seeing these features of subacute combined degeneration of spinal cord, that means they are talking about vitamin B12 or cobalamin deficiency. It cannot be vitamin B6 or pyridoxine. The reason is, as they mentioned, SAGT. SAGT is never a feature associated with pyridoxine. It is always a feature associated with B12 deficiency. B12 सरकारी है vitamin तुम्हारे एग्जाम का, जल्दी से टेबल. Vitamin B1 is known as thiamine. Thiamine deficiency in normal patient will lead to beriberi. Beriberi can be wet beriberi or dry beriberi. Important is, please tell me, thiamine deficiency is usually seen in which patient? क्या? It is usually seen in polished rice eaters because thiamine is present in the outer layer of rice itself. ठीक है? In chronic alcoholic patient हैं? In chronic alcoholic patient due to vitamin B1 or thiamine deficiency, the condition that leads is known as Wernicke's-Korsakoff syndrome. Now, in the initial phase of the disease, the patient will develop Wernicke's encephalopathy, and in the later part of the disease, the patient develops Korsakoff's psychosis. Wernicke's encephalopathy is characterized by a classical triad known as GOVA. G stands for global confusion, O stands for ophthalmoplegia, and A stands for ataxia. Shabash. Korsakoff psychosis is seen in severe condition where the patient will have loss of memory. That is nothing else but dementia. Along with that, a very characteristic feature, making up false stories to fill up the memory gaps. ये previous year question है. Very good. Confabulation. Previous year FMG question. Confabulation is a characteristic symptom seen in Korsakoff psychosis. Psychiatric का question था ये. No issues with this anybody? Great. Next is vitamin B2, also known as राइबोफ्लाविन. ये टेबल इसलिए फिलअप कर रहे हैं क्योंकि आगे बहुत विटामिन के क्वेश्चंस है, सब इससे सॉल्व हो जाने चाहिए. आई एम नॉट रिपीटिंग एवरीथिंग अगेन. ओके, तो विटामिन B2 इज आल्सो नोन एज राइबोफ्लाविन. राइबोफ्लाविन डेफिशिएंसी लीड्स टू A riboflavinosis. A riboflavinosis is characterized by three features. First is inflammation of lips known as chelosis. So inflammation of lips is known as chelosis. Inflammation of angles of mouth is known as angular stomatitis. Inflammation of angles of mouth is known as angular stomatitis. And inflammation of the tongue is known as glossitis. But किस type का glossitis दिखता है? Atrophic glossitis. And due to this atrophic glossitis, the tongue will have a characteristic feature. It will be appearing beefy red. पहले तो beefy red, or it is known as magenta tongue. Please remember, beefy red tongue will be called as magenta tongue, or it will have some red or white patches. That will be called as geographic tongue. In one of the previous year exams, geographic tongue was given in the image, but vitamin B2 was not an option. Then your answer should be very good. Vitamin B12. वही तीन जो क्वेश्चन आए थे उसमें से एक geographic tongue था. Please remember. So if they say geographic tongue in the image, but vitamin B2 or riboflavin is not an option, the second best answer should be vitamin B12 or cobalamin. No issues with this, anybody? Important. If they ask you, out of these three classical features of A riboflavinosis, which is the most characteristic or the most specific feature? Very good. The most specific feature should be angular stomatitis. Okay, most specific feature should be angular stomatitis. कोई दिक्कत नहीं है. तो जल्दी से, what is the classical triad of A riboflavinosis? First is chelosis. Second is angular stomatitis. Third is atrophic glossitis. Atrophic glossitis can form beefy red tongue known as magenta tongue, or red and white patch geographic tongue. Most specific or most characteristic feature is angular stomatitis. Shabash. Vitamin B3 सरकारी. इसको जितने और स्टार या क्वेश्चन मार्क कर सकते हो कर लो. हर एग्जाम, not even a single exam, okay, has been there without niacin. कोई एग्जाम नहीं. नीट पीजी देख लो, तुम एफएमजी देख लो, कोई सिंगल एग्जाम नहीं है इसके बिना. ठीक है, अगर तुम्हें नहीं देते तो तुम पहली बैच होंगे फिर. ठीक है, तो niacin deficiency और vitamin B3 deficiency leads to a classical condition known as pellagra. And pellagra is seen in which patients? Shabash. Pellagra is seen in maize eaters, because maize is deficient in amino acid from which vitamin B3 is formed. There are only two vitamins in the body which can be formed. Vitamins तुम बाहर से लेते हो या बॉडी में बनते हैं? बाहर से लेते हैं. There are only two vitamins in the body which can be formed inside your body. One is vitamin D and second is vitamin. किससे बनता है भाई vitamin B12? बताना जरा. तो फिर वेजिटेरियंस में डेफिशिएंसी क्यों है? Vitamin D and vitamin B3. Vitamin B3 also known as niacin. It is formed by an amino acid known as tryptophan. Okay, so usually this tryptophan is deficient in maize, and as tryptophan is deficient in maize, maize eaters will also have deficiency of vitamin D3 or niacin. Second, usually कौन से? Very good. Jawar eaters known as sorghum eaters. Okay, sorghum is nothing but jawar जो खाते हो ना, तो usually sorghum eaters are also at a risk of developing deficiency of vitamin B3. Reason is jawar has a lot and lot of which amino acid? Leucine. Jawar or sorghum has a lot of leucine, and leucine is amino acid which stops the conversion of tryptophan to vitamin B3. Agar leucine stop the conversion of tryptophan to vitamin B3, will vitamin B3 be formed in the body? No. That's the reason why patient develops pellagra. So not only maize eaters but also sorghum eaters. Another question was, which is a pelagrodenic amino acid? Answer batao. वेरी गुड. पेलाग्रा कॉजिंग ना, पेलाग्रोजेनिक का मतलब क्या? पेलाग्रा कॉजिंग. तो पेलाग्रोजेनिक अमाइनो एसिड आंसर शुड बी leucine. Okay, so that's important. That was a previous year question. And pellagra is characterized by how many D's? पहले 3D, फिर 4D, फिर 5D, now finally 6Ds. The first D is nothing else but diarrhea in the patient. Second D is nothing but dermatitis. And the classical dermatitis seen in this patient is known as कौन सा नेकलेस? कजाल्स नेकलेस या कहाल्स नेकलेस, कुछ भी बोल लो, ठीक है. थर्ड डी इज नथिंग एल्स बट dementia, that is loss of memory. Fourth D is nothing but death. Fifth D is nothing but delirium. What is delirium? Clouding of consciousness. Patient अपने senses में नहीं होता, उसको बोलते हैं delirium. Get the definition of delirium right, it will help you a lot. याद रखने बात. Delirium. And last one is depression. So jaldi se 6 D's of pellagra. First D for diarrhea, second D for dermatitis, third D for dementia, fourth D for death, fifth D for delirium, and sixth D for depression. Dermatitis classically seen around neck, known as Cazals necklace. No issues with this. ये रटा हुआ होना चाहिए. Pellagra जिसको नहीं आता, please make sure you read everything about pellagra. Next is vitamin B5, also known as pantothenic acid. Important, deficiency of vitamin B5 or pantothenic acid causes, very good, it causes burning foot syndrome, also known as burning soul syndrome. So it is one and the same thing. Okay, burning foot syndrome. Vitamin B6 is also known as pyridoxine, and pyridoxine or vitamin B6 deficiency leads to which type of anemia? Microcytic anemia. Basic reason is easy hai bahut. Vitamin B6 is required as a coenzyme by the enzymes in the heme synthesis pathway. तो अगर vitamin B6 या pyridoxine body में नहीं है तो heme synthesis होगा क्या? नहीं होगा. Heme synthesis नहीं होगा तो hemoglobin बनेगा क्या? नहीं होगा. That's the reason why patient develops a microcytic hypochromic anemia. ठीक है, पूरा नाम लिख लो. It is microcytic hypochromic anemia which develops in the patient. Next important thing is patient also develops numbness and tingling sensation in the periphery. That is nothing else but boro peripheral neuropathy. Today's class, जितना एक्टिव रह सकते हो रहो. This will help you revise a lot of things. गलतियां करते हो ना, कोई दिक्कत नहीं. कौन जज करने वाला है? साइड वाले को भी 4 चीजें नहीं आती, ठीक है, तुम्हें नहीं आती तो क्या दिक्कत है? Does not matter. चिल्लाओ. मैं बताता हूँ, चिल्लाओ. जो दिक्कत है वो देख लेंगे, ठीक है. Will call विकास सर, कोई दिक्कत नहीं, ठीक है. Next is vitamin B9. Vitamin B9 is also known as folic acid. It can also be called as folate. Active form बता दो, इसका क्वेश्चन आया था. Active form of folic acid is known as शाबाश THF, that is tetrahydrofolate. Active form of folic acid is known as tetrahydrofolate. Folic acid deficiency, chalo, folic acid deficiency during pregnancy will lead to neural tube defect. That's the reason why folic acid is given during pregnancy. What is the dose of folic acid supplementation during pregnancy? Normal dose. WHO recommends 400 microgram, but in India we give 500 micrograms. Indian healthcare program mein the dose of folic acid is 500 micrograms. But if there is a high risk pregnancy, what is a high risk pregnancy? If there is a previous history of neural tube defect or the patient is currently on anti-epileptic drugs like valproate. क्या होता है इन ड्रग्स की वजह से? Patient develops folic acid deficiency. तो इसीलिए in these two conditions, in high risk pregnancies, the dose of folic acid should be 10 times, that is around 4 milligram या 4000 microgram. ठीक है? So please remember, in high risk pregnancies, the dose of folic acid, this was a previous year question, answer should be 4 milligram mg. ठीक है? Whereas in normal patient, if there is vitamin B9 deficiency, it leads to megaloblastic anemia usually. ठीक है? And folic acid deficiency is seen in which patients? The patients who are not taking enough of So the patients who are not taking green leafy vegetables, in patients mein there is folic acid deficiency. This was the recent previous year question of your exam. They said that there is a sorry, uh, this one corporate office worker who is having a sedentary lifestyle. She orders a lot of fast food and she has decreased green leafy vegetables in her diet. Which vitamin deficiencies she is likely to develop? Answer was folic acid deficiency. Easy. Okay? So that's important. A lot of people felt vitamin B12. Nahi bhai. Vitamin B12 deficiency usually it occurs in vegetarian patients who are usually on the green leafy vegetable diet. Okay, so that's the basic important thing. Vitamin B12 is also known as cobalamin, and cobalamin is also the drug of choice for previous year question. Cyanide toxicity or cyanide poisoning. So please remember, cyanide poisoning के लिए drug of choice is vitamin B12, also known as cobalamin. चलो, cobalamin deficiency or vitamin B12 deficiency will lead to megaloblastic anemia. So when there is deficiency of vitamin B9 and B12, it causes megaloblastic anemia. But if a patient is having type A gastritis, what is type A gastritis? Autoimmune gastritis. There is antibodies produced against which cell of stomach? Parietal cells of stomach. So there is deficiency of HCl. Along with that, there's deficiency of which factor? Intrinsic factor of Castle, which is required for the absorption of vitamin B12. Will there be vitamin B12 absorption? No. So vitamin B12 absorption occurs in which part of the intestine? Terminal ileum. तीन चीजों के absorption site से याद रखना है. Iron, duodenum. Folic acid, jejunum. And vitamin B12, ileum. ठीक है, तो वापस iron, duodenum. Folic acid, jejunum. B12, ileum. कोई दिक्कत नहीं है, ये सीधा सीधा क्वेश्चन आ चुका है. ठीक है. So in this patient there will be vitamin B12 deficiency and this type of anemia will be called as pernicious anemia. Shabbat. So the anemia due to vitamin B12 deficiency in a type A gastritis or autoimmune gastritis patient is known as pernicious anemia. Next, patient also develops peripheral neuropathy and the patient also develops severe neurological condition. Abhi dekhi jo. Subacute combined degeneration of spinal cord, damage of which which column? Posterior or the dorsal column. ठीक है, कोई दिक्कत नहीं है इसमें. Please remember, vitamin C is also known as ascorbic acid. Deficiency of ascorbic acid or vitamin C will cause scurvy in the patient. Scurvy is characterized by, very good. What is seen over here? The patient will have gum bleeding. Along with gum bleeding, the patient will have small bleeding spots known as petechiae. Along with that, the patient will have subperiosteal hemorrhages. क्या बोलते हो subperiosteal hemorrhages की वजह से क्या होता है? सो बोन जो है, बोन की कवरिंग को बोला जाता है पेरियोस्टियम. इन दोनों के बीच में देयर इज हेमोरेजेस व्हिच विल अकर. ड्यू टू दैट द चाइल्ड विल हैव अ लॉट ऑफ स्वेलिंग एंड अ लॉट ऑफ पेन इन हिज calf region, due to which the child cries and the child cannot walk. Is the child having paralysis? No. But because of that pain, the child is not able to walk. That is what is called as pseudo paralysis. That they mention in the question usually. Okay? So pseudo paralysis usually due to swelling and pain in the calf region also develops in scurvy in the patient. Okay? So that's important. So क्या क्या तीन चीजें होती है? First is gum bleeding. Second is petechiae. And third is pseudo paralysis due to the subperiosteal hemorrhages. Next is vitamin D, also known as active form. Calcitriol. Calcitriol can also be called as 1,25-dihydroxycholecalciferol. क्वेश्चन है, में लगेगा कि यार ये कैसे क्वेश्चन है? ऐसे भी क्वेश्चन पूछे जा चुके हैं. एक्टिव फॉर्म बस पूछा है बस. ठीक है. तो calcitriol also known as 1,25-dihydroxycholecalciferol. Now deficiency of vitamin D during childhood will lead to rickets. Very good. Deficiency of vitamin D during childhood leads to rickets, and deficiency of vitamin D during adulthood leads to osteomalacia. It causes osteomalacia in the patient. No issues with this. Osteomalacia. Malacia का मतलब होता है weakness. So the patient will have weakness of bones usually. No issues with this, anybody? So that's important. Next, selenium deficiency. Very good. These are minerals now. Selenium deficiency causes Cation's disease. And what is Cation's disease? एक बार Cation's option में नहीं था. Very good. It is a dilated cardiomyopathy, but it occurs in a lot of patients in that particular area. Therefore, it is called as a endemic cardiomyopathy. It can also be called as endemic cardiomyopathy. ठीक है? Zinc deficiency leads to in children dermatitis around the mouth and in the groin or the inguinal region. That is what is classically called as acrodermatitis enteropathica. Important is zinc deficiency will occur in children who are suffering from बच्चों diarrhea ना. So the children who are suffering from diarrhea, they will also develop zinc deficiency, and that is what is called as acrodermatitis enteropathica. Therefore, in a patient of diarrhea, you will give ORS, but along with ORS, you will also give zinc. Question previous year. याद रखना ये जो भी चीजें मैं बोल रहा हूँ, these have been previous year question, और यही इंटीग्रेशन होता है. Does not care इस पॉइंट पे आके कि कौन सा सब्जेक्ट है मैं उस, it is integration of everything. ठीक है? तो डायरिया में जिंक supplementation दिया जाता है. What is the dose of zinc supplementation? Less than 6 months, 10 mg. Very good. Less than 6 months it is 10 mg, and more than 6 months it should be 20 mg. Shabash. More than 6 months it should be 20 mg. So in which patients you will give zinc supplementation in a child suffering from diarrhea? Less than 6 months, 10 mg. More than 6 months, 20 mg. याद रखना. Chromium deficiency leads to, what is IgT? Impaired glucose tolerance. Impaired glucose tolerance. मतलब patient में diabetes वाले तो level नहीं है, but the patient is having blood glucose levels which are high. That is nothing else but pre-diabetes. IgT का मतलब होता है pre-diabetes. ठीक है? So that's important. Sure. Question number 6 now. It says a teenager presents with features of liver disease, tremor, and poor in coordination, mask-like faces, and psychiatric symptoms. Which of the following is implicated in the pathogenesis of this condition? Provisional diagnosis is Shabash. Wilson's disease. And Wilson's disease is due to copper toxicity or copper deficiency. Copper. So Wilson's disease is due to copper excess or copper toxicity inside the body. Why? Because the copper transport protein is deficient. Which is that copper transport protein? Shabash. Ceruloplasmin. Copper transport protein is known as ceruloplasmin, and it is deficient, and that causes excess of free copper inside your body. अब excess of copper is there. What will happen? It deposit in various organs of your body. The first organ where it deposits is nothing else but your liver. And when it deposits in the liver, there will be enlargement of liver. That causes hepatomegaly. Second, it will start causing damage to the liver. That is called as hepatitis. And finally, it will land up into cirrhosis. So start कहाँ से होता है? Hepatitis, but ends up into cirrhosis. So Wilson disease can also lead to cirrhosis. याद रखनी है बात. ठीक है? Next, it can deposit where? It can deposit in the brain. Which part of the brain? Basal ganglia. And when it deposits in the basal ganglia, it will cause deficiency of a neurotransmitter. That neurotransmitter is known as barabar. When it deposits in the basal ganglia, it causes deficiency of dopamine. Why? Because dopamine is secreted by a structure in basal ganglia, and that structure is known as substantia nigra. So please remember, when this excess of copper will deposit into substantia nigra, will be deficiency of dopamine. And deficiency of dopamine leads to which condition? Anybody bachcho? Shabash. Parkinson's disease. So a patient of Wilson's disease also will develop features like Parkinsonism. What are the classical 3 features of Parkinsonism? First is pin rolling tremors. So resting, pin rolling tremors. Second is rigidity. Upper limb rigidity is known as cog wheel rigidity. Upper limb rigidity is known as cog wheel rigidity. And lower limb rigidity is known as lead pipe rigidity. Lower limb rigidity is known as lead pipe rigidity. And last and most important feature, slow movement. That is nothing else but bradykinesia. So what are the classical triad of Parkinsonism? क्योंकि बच्चों ये याद रखना, ये तीन फीचर्स होंगे तुम्हारे क्वेश्चन में जरूर, इसके बिना पार्किंसनिज्म का डायग्नोसिस बनता ही नहीं। ठीक है, तो ये होता है कि ये इनको उठाना जरूरी होता है। तो फर्स्ट फीचर इज व्हाट, विच काइंड ऑफ ट्रेमर्स, रेस्टिंग पिन रोलिंग ट्रेमर्स। सेकंड, देयर विल बी स्टिफनेस, दैट इज रिजिडिटी, एंड थर्ड देयर विल बी ब्रैडीकाइनेसिया। इन तीनों में से सबसे कैरेक्टरिस्टिक फीचर पूछा जाए तो आंसर इज ब्रैडीकाइनेसिया। ओके, सबसे कैरेक्टरिस्टिक फीचर विच इज ओनली सीन इन पार्किंसनिज्म, आंसर इज bradykinesia. Along with that, the patient will have this kind of a posture. What is this kind of a posture? Stooped posture. झुक के चलता है बंदा. Or he'll have this kind of steps. Shuffling steps. That is also known as fascinating gait. Okay, shuffling steps, also known as fascinating gait, will be seen. No issues with this. So Parkinsonism-like features are seen in which condition? Wilson's disease में दिखती है. ठीक है? And finally, this excess of copper will also deposit where? In the eyes, in two structure of eyes. First is Descemet's membrane. Okay, I heard basement. So one is the Descemet's membrane of cornea. And when it deposits in the Descemet's membrane of cornea, it leads to formation of which ring? KF ring. KF ring is also known as Kayser-Fleischer ring. Whereas when it deposits into lens, लेंस में डिपॉजिट होगा तो ही तो ओपेसिटी होगी ना बच्चों। तो व्हेन इट डिपॉजिट्स इनटू द लेंस, इट कॉजेस व्हिच टाइप ऑफ कैटरैक्ट? सनफ्लावर कैटरैक्ट। तो अभी तक अगर लग रहा था यू आर नॉट वेल प्रिपेयर्ड, गेट दैट थिंग आउट ऑफ योर माइंड। ठीक है, अच्छे से आंसर कर रहे हो ना, दैट मीन्स यू आर प्रिपेयर्ड। कुछ चीजें नहीं आती होंगी, कोई दिक्कत नहीं, 1 महीने का टाइम है यही पढ़ने के लिए अपने पास। ठीक है, so be with that positive attitude throughout the session now. ठीक है, so important is when excess of copper deposits in the Descemet's membrane of cornea, what is formed? KF ring. That is nothing else but Kayser-Fleischer ring. सरकारी इमेज है तुम्हारे एग्जाम, ठीक है, ऑफ्था की। And next is when excess of copper deposits in the lens, that causes sunflower cataract. All of this is nothing but Wilson's disease. Now, Wilson's disease is due to degeneration or damage to liver and basal ganglia. Basal ganglia is also known as lenticle. Therefore, Wilson's disease, एक बार ऑप्शन में Wilson's ना होते हुए, very good. It can also be called as hepatolenticular degeneration. It can also be called as hepatolenticular degeneration. Now, please tell me the gene. It is nothing else but ATP7B gene mutation on chromosome number 13. Now, ATP7A gene mutation on chromosome number 13. Shabash. It causes which condition? Menkes disease. And Menkes disease is copper excess or copper deficiency, बच्चों. Shabash. Menkes disease is nothing but copper deficiency. And in cases of Menkes disease, you can see this classical feature. क्या दिख रहा है? Very good. बच्चे में ज्यादा बाल है, कम बाल है, कम. That is called as sparse. Easily breakable. That is nothing else but kinky. So this is the classical feature. Sparse or kinky hair in the child, along with muscle weakness, and there will be decreased tone of muscle, that is called as hypotonia. Okay, so these are the classical feature in a case of Menkes disease. ठीक है, क्यों important है? Because copper deficiency जो है, copper is required for the last step of collagen synthesis. Copper is required as a cofactor for lysyl oxidase enzyme. Okay, अगर copper नहीं है तो lysyl oxidase काम करेगी क्या? नहीं. So will the last step of collagen synthesis occur? No. And what is the last step of collagen synthesis? To make the collagen strong. तो collagen तो बनेगा, but वो strong बन रहा है क्या अभी? नहीं बन रहा, because the last step is not occurring. So therefore, weak collagen is formed or defective collagen is formed in the patient. That's the reason why the hairs are easily breakable in the patient. The muscles are very weak in the patient. ठीक है? So that's the basic reason. No issues with this anybody? जिसको बताती है M पहले आता है W के बाद में आता है, पहले आता है, तो ATP7A जीन म्यूटेशन है Menkes डिसीज. W बाद में आता है ना, तो ATP7B जीन म्यूटेशन है Wilson's disease. That's how simple it is. ठीक है, APP gene mutation anybody on chromosome number 21. APP, amyloid precursor protein gene mutation on chromosome number 21 is known to cause Alzheimer's disease. Please remember, it is known to cause Alzheimer's disease is due to APP gene mutation or presenilin 1 और presenilin 2 gene mutation. 3 gene mutation होते हैं, ठीक है? तो now Alzheimer's disease में usually if I take a gross specimen, patient मर गया Alzheimer's का. I hope all of you are quite aware. Alzheimer's disease is the most common cause of dementia. What is dementia? Memory loss. Alzheimer's किस patient में होता है? Young या elderly? Elderly patient में ज्यादा common है, ठीक है? Usually in the 7th or 8th decade of life, इतना बुढ़ों में, ठीक है? So that's the important thing. And if the patient dies and if we take the autopsy, you will see there is cerebral atrophy. The size of the brain will shrink down. छोटा हो जाएगा. And if I take a biopsy in a case of Alzheimer's disease, what I'll see two important things. In between, आने दो उधर तक, ठीक है? हाँ. So in between the neurons, definitely I'll see formation of senile plaques, senile neural plaques, also known as amyloid plaques. They are due to deposition of which protein? They are due to deposition of A beta amyloid. याद रख लो, what is an amyloid protein बच्चों? Amyloid is a misfolded or an abnormal protein. तो वो जहां जहां डिपॉजिट होगा वहां कोई ना कोई दिक्कत करेगा. तो अल्जाइमर्स में ऐसे दो प्रोटीन या दो अमाइलॉइड डिपॉजिट होते हैं. वन इज ए बीटा अमाइलॉइड which deposits in between the neurons and that leads to formation of neural plaques. That leads to formation of neural plaques. That are most common feature. But if they ask you most characteristic feature जो बस अल्जाइमर्स में ही दिखता है, that is due to deposition of a protein. You rightly termed it as tau protein, and that tau protein deposits inside the neurons and that leads to formation of neurofibrillary tangles. So T for T easy है. Tau protein causes tangles. ठीक है? तो A beta amyloid by default will cause plaques. ठीक है? So two features on biopsy in a case of Alzheimer's disease. First is due to deposition of A beta amyloid. What is formed? Neural plaques. Due to deposition of tau protein. What is formed? Neurofibrillary tangles. Characteristic neurofibrillary tangles. कौन सी bodies? ये भी बता दो. चलो चलो. Hirano body. शाबाश. Okay, which bodies are formed? It is the Hirano body. And lastly, SOD1 gene mutation on chromosome number 21. Very good. It causes ALS. SOD is nothing but superoxide dismutase 1 gene on chromosome number 21. If it gets mutated, it leads to myotrophic sclerosis as well as lower motor neuron disease. दोनों के दोनों जाते हैं पेशेंट में. किस हुआ था? स्टीफन किंग्स को. ठीक है? तो वही डिसीज की बात चल रही है. Amyotrophic lateral sclerosis. Just remember the question. That's it. Question number 7 now. A child presented, okay, a child presented with history of pallor, fatigue. Pallor and fatigue are classical signs of anemia. जिस भी question में pallor और fatigue दिख रहा है, think in terms of anemia. Next, there is petechial bleeding. Petechiae are what? Small bleeding spots. So petechiae भी और bleeding भी. It is due to deficiency of which blood cells? Platelets. So definitely, petechial bleeding is suggestive of thrombocytopenia. That is decreased platelet count. And there is fever also in the child since the last 7 days. On examination, he was having enlargement of liver and spleen. That is nothing but hepatosplenomegaly. Okay, so there is also hepatosplenomegaly on examination. And most important, क्या दिख रहा है बच्चे में? Sternal tenderness. There is sternal tenderness. क्या sternal tenderness का मतलब? When you touch a sternum, the patient cries out in pain. Whenever you hold the child like this, बच्चे में बहुत दर्द होता है और बच्चा बहुत रोता है. ठीक है? Which of the following is the likely explanation for the symptoms in the child? Very good. Now it is a case of anemia or leukemia. Important है, चलो पहले तो rule out कर लो. Option A, aplastic anemia. Why it is not aplastic anemia in a case of aplastic anemia? Very good. Important is क्या? Aplastic का क्या मतलब होता है? कुछ बन रहा है कि उसके बोन मैरो में? कुछ नहीं बन रहा. नॉर्मली अगर मैं बोन मैरो बायोप्सी लूंगा तो नॉर्मल बोन मैरो बायोप्सी कैसी दिखेगी? आई विल हैव अ लॉट एंड लॉट ऑफ हेमाटोपोएटिक स्टेम सेल्स. मुझे आरबीसी दिखेंगी, डब्ल्यूबीसी दिखेंगी, प्लेटलेट्स दिखेंगे. बट इन aplastic anemia, I'll see literally no blood cells or no hematopoietic stem cells. भर भर के क्या दिखेगा? Fat. Okay, so when I take a bone marrow biopsy or a bone marrow aspiration, I'll see a lot of fat over there and no blood cells. So if there are no blood cells, the patient will have deficiency of RBCs causing anemia in the patient. The patient will have deficiency of WBCs causing leukopenia in the patient. The patient with deficiency of platelets causing thrombocytopenia in the patient. And all of these agar come hai, so that is nothing else but pancytopenia in the patient. Now in this child, definitely pancytopenia can be there क्योंकि thrombocytopenia बोला है, anemia बोला है. Important is fever भी बोला है. Fever is suggestive of infection, and infections can occur due to increased or decreased leukocyte. Does not matter. Important is, but they have already said about sternal tenderness or they have said about hepatosplenomegaly. When does hepatosplenomegaly occur? कब enlargement होगा? जब liver और spleen over time काम कर रहे हैं या कम काम कर रहे हैं? ओवर टाइम काम कर रहे हैं. इसमें ब्लड सेल्स ही नहीं बन रहे तो ओवर टाइम काम करेंगे कि तुम्हारे लिवर एंड स्प्लीन? नहीं. लिवर एंड स्प्लीन कब काम करते ओवर टाइम? जब उनको किसी को खत्म करना होता है. यहाँ खत्म करेंगे क्या? वो नहीं करते. So therefore, aplastic anemia में the patient will not have characteristic sternal tenderness or hepatosplenomegaly. That's the reason why I can easily rule out aplastic anemia. Next option is chronic myeloid leukemia. Important is बच्चे की कौन है? बच्चा या adult है? बच्चा है. Chronic myeloid leukemia is common in which age group? Adults usually rather. Okay, so CML has been ruled out. And important is in CML there is hepatosplenomegaly, but ज़्यादा बड़ा क्या होता है? Spleen या liver? Spleen. There is a massive splenomegaly in a case of CML, which is not seen over here. Sternal tenderness is not a feature of CML again. Okay, next is acute myelogenous leukemia, AML. Now, acute myelogenous leukemia is also common in which age group? Again, elderly patient, around 60 to 70 years of age. Okay, and in a case of AML, again, the patient will not have this characteristic sternal tenderness. बाकी सब features होंगे, but sternal tenderness and age group does not favor AML in the patient. Therefore, my diagnosis is directly acute lymphoblastic leukemia. That is nothing but ALL. Important is ALL is also the most common malignancy in children बच्चों. So most common cancer बच्चों में अगर कोई होता है, answer is directly ALL. Yes, acute lymphoblastic leukemia is the most common malignancy in children overall. ठीक है? No issues with this anybody? That's important. अगर मैं bone marrow biopsy लेता हूँ, what I'll see something like this. What are these? ALL में और rods दिखने लग जाते हैं. Now important is basic. जल्दी से बताओ जल्दी से. Important thing is ALL और CLL दोनों में डिफरेंस करना होगा. तो मैच्योर सेल्स किस में ज्यादा होंगे? CLL में. ठीक है? और इमेच्योर सेल्स किस में ज्यादा होंगे? ALL में. Immature cells are called as blast cells usually. Blast cells less than 20% will be a chronic leukemia, but blast cells more than 20% will be a diagnosis of acute leukemia. So definitely in cases of ALL, blast cells होंगे more than 20%. Which was lymphoblast or myeloblast? It should be more than 20% of lymphoblast. Lymphocytes में न्यूक्लियस कैसा होता है? बड़ा सा न्यूक्लियस होता है. कोई ग्रैन्यूल्स होते हैं क्या साइटोप्लाज्म में? कुछ नहीं होता. ठीक है? इट इज a granulocyte ना. Therefore, a large nucleus in the blood cell, okay, without any granules, and a lot of such immature cells known as lymphoblasts. That is what is suggestive of ALL in the patient. AML में very characteristic feature. ALL में these lymphoblasts which are there, they are MPO positive or PAS positive? Very good. These are PAS positive. Please remember, which type of ALL is more common? B type ALL or T type ALL? T type ALL. ठीक है? B सेल से कुछ भी होना, safe answer is B type. याद रखना ये बात. B type का ALL ज्यादा common होता है. Please remember that. Okay? No issues with this anybody? That's important. Next, what is this? This is the bone marrow biopsy seen in cases of AML. What is AML? Acute myeloid leukemia. In acute myeloid leukemia, these are more than 20%. But इस बार कौन से mature cells होंगे? Myeloblast. So more than 20% myeloblast in the peripheral circulation or in the bone marrow biopsy is suggestive of AML in the patient. More than 20% myeloblast. Myeloblasts are MPO positive or PAS positive? MPO. नाम में ही है ना, myeloperoxidase. So they are myeloperoxidase positive. Important, in the cytoplasm we get this characteristic rods known as OR rods. समझे? तो cytoplasm में the characteristic rod known as OR rods are a feature of AML, not ALL बच्चों. ठीक है? So that's important. No issues with this anybody? Got it? चलो जल्दी से बता दो, इन्वेस्टिगेशन ऑफ चॉइस दोनों के लिए सेम है, राइट? इन्वेस्टिगेशन ऑफ चॉइस इज अ बोन मैरो बायोप्सी और अ बोन मैरो एस्पिरेशन। ट्रीटमेंट ऑफ चॉइस दोनों के लिए सेम है, बताओ, एएलएल एएमएल दोनों के लिए। Hematopoietic stem cell transplantation. So hematopoietic stem cell transplantation is the treatment of choice. No issues with this. I'll talk about chemotherapy. Treatment of choice. Best treatment overall की बात चल रही है, ठीक है? कॉमन ट्रीटमेंट की बात नहीं चल रही, याद रखना, बेस्ट ट्रीटमेंट की बात चल रही है ओवरऑल। क्वेश्चन नंबर 8 नाउ, जल्दी से। अ टॉल मेल टीनेजर presented with gynecomastia on examination absence of secondary sexual characteristics is noted. सेकेंडरी सेक्सुअल कैरेक्टरिस्टिक्स क्या क्या होते हैं, जल्दी बताओ। मेल्स में प्यूबिक हेयर, एक्सिलरी हेयर्स और बेड, ठीक है? एंड अलोंग विद दैट समटाइम्स होर्सनेस ऑफ वॉइस। दीज आर द सेकेंडरी सेक्सुअल कैरेक्टरिस्टिक्स इन अ मेल which a male achieves during puberty. He has average cognition and characteristics are deep voice, bed, and male distribution of pubic hair. His genetic analysis was performed and he had presence of bar body. What is a bar body? Inactive X chromosome. ठीक है, bar body is nothing but an inactivated X chromosome. Please remember. ठीक है, no issues with this. Now normally a normal female, जल्दी से बताओ, what is a normal female genotype? 46XX. So number of bar body is the number of X chromosome minus 1. तो normal female में कितनी bar bodies होती है बच्चों? एक बार बॉडी। नॉर्मल मेल में what is the genotype? 46XY. So one less than the number of X chromosome. तो नॉर्मल मेल में कितनी बार बॉडी? 0. But a patient of Klinefelter, what is the genotype? It is 47XXY. So normally males have bar body of what? No. But in cases of Klinefelter syndrome, the patient will have one bar body. In a case of Turner syndrome female, normally what is the genotype? 45XO. So kitni bar body? 0. So normal female has one bar body and normal male has 0 bar body. But a patient of Klinefelter, a male of Klinefelter syndrome will have one bar body and a female of Turner syndrome will have 0 bar body. Shabash. No issues with this, anybody? Chalo. So what is the likely diagnosis of this patient? It is mostly a case of Klinefelter syndrome. इंपॉर्टेंट, तुम बोलोगे सर टर्नर सिंड्रोम क्यों नहीं? बिकॉज टर्नर सिंड्रोम में बार बॉडी नहीं होती है एंड पेशेंट फिनोटाइपिकली मेल होता है, फीमेल होती है बच्चों? फीमेल होती है। सो टर्नर सिंड्रोम इज इजीली रूल्ड आउट। नेक्स्ट, स्वायर सिंड्रोम। स्वायर सिंड्रोम इज नथिंग बट प्योर गोनाडल डिसजेनेसिस। क्या मतलब है इसका? गोनाड्स बनते ही नहीं है, खराब गोनाड्स होता है। नाउ इंपॉर्टेंट, व्हाट इज द जीनोटाइप ऑफ स्वायर सिंड्रोम बच्चों? 46XY। नॉर्मल जीनोटाइप होता है 46XY। Now, if there is 46XY, number of bar bodies will be 0. So, as they have given over here one bar body, can it be a case of Swyer syndrome? No, it cannot be a case of Swyer syndrome. Second reason for it is Swyer syndrome is phenotypically male or female? Very good. Okay, so phenotypically the patient is a female. क्यों? Because 46XY है, तो patient में कौन से gonads होंगे? Testis या ovaries? Testis. But कैसी testis होंगी? स्ट्रीक टेस्टिस, मतलब खराब टेस्टिस होती है। अगर खराब टेस्टिस है तो टेस्टोस्टेरोन बनेगा क्या? नहीं बनता। एंड इफ टेस्टोस्टेरोन इज नॉट फॉर्म, will his genitalia will be male or female? Female, because male genitalia could not develop and the default genitalia of a human is female. अगर मेल नहीं डेवलप होता तो बन क्या जाएगा? फीमेल। therefore the patient is phenotypically, बाहर से दिखने के लिए क्या होगा? फीमेल होगा। ठीक है, तो बाहर से दिखने के लिए फीमेल। जीनोटाइप 46XY। गोनाड्स कौन से होंगे? टेस्टिस, बट नॉर्मल या खराब? खराब। ठीक है, सो दैट्स द बेसिक थिंग। डाउन सिंड्रोम वी नो एनी विच वेज, here there is a normal genotype, only problem is not with the sex chromosome, the problem is with the autosome. कौन सा क्रोमोसोम? क्रोमोसोम नंबर 21। क्या होता है, मोनोसोमी या ट्राइसोमी? ट्राइसोमी। there are 3 alleles of chromosome number 21। जल्दी से, Klinefelter syndrome, what is the genotype? 46XXY। कितनी बार बॉडी? 1 bar body. Okay, important, it is mainly seen in males. What will be the feature? The patient will not be able to beget children, that is called as sterility. The testis will be atrophied. क्यों? क्योंकि 2 X chromosome है ना, therefore there will be more of estrogen which is produced and therefore there will be atrophy of the testis. There will be gynecomastia, that is nothing but breast enlargement in the patient. Along with that, the body hair in the patient will be reduced, कम होंगे, ठीक है? Beard will be lesser. The facial hair in the patient will be lesser. Height will be small or tall? Tall. Turner syndrome height is small or tall, short or tall? Short. That's important. ठीक है? The patient will have osteoporosis. Fat distribution will be like a female, and the testis will be small due to testicular atrophy. On the other hand, this is a case of Turner syndrome. What is the genotype? Anybody? 45XO. Important is the patient will have a tall or short stature? Short stature. The patient will have IUGR, that is intrauterine growth restriction. There will be webbing of neck. Along with that, there will be lymph edema. Important is कैसी chest होगी patient की? Shield shape or a flat chest. Along with nipples will be widely spaced away from each other. Then apart from that, the patient will have gonadal degenesis. मतलब ovaries will be present, but the ovaries will be streak ovaries, मतलब kharab ovaries. Okay. Therefore, can the patient have menses? No. So if the patient is not having menses, that will lead to primary amenorrhea. Along with that, the patient will have infertility due to the same reason, and there will be lack of secondary sexual characteristics. Along with that, important है, the patient will have increased carrying angle of elbow. बाहर की तरफ होगा elbow. इसको क्या बोलते हो? कौन सी deformity? Cubitus valgus. Shabash. So the patient will have a cubitus valgus deformity. This is an important previous year question. Cubitus valgus deformity दिखती है patient में. ठीक है, याद रखना. Next, apart from that, there will be inward curvature of the fifth metacarpal. What is that called as? Very good. बोलो बोलो. Clinodactyly. So clinodactyly is an important feature. Okay, short fourth metacarpal. Okay, inward curvature of short fourth metacarpal, that is called as clinodactyly. जल्दी से previous year questions कर रहे हैं ना अपन. तो most common congenital heart defect in a case of Turner syndrome. Shabash. It should be bicuspid aortic valve. So most common congenital heart defect in Turner syndrome, answer should be bicuspid aortic valve, followed by second most common coarctation of aorta. Both have been questions. ठीक है? So most common is bicuspid aortic valve. Second most common is coarctation of aorta. चलो आगे बढ़े. Question number 9. The muscle in the mark structure is involved. Which among the following action will be compromised at the shoulder joint? What is the muscle in the mark structure? First of all, ये mark structure क्या है? Supraspinatus क्या है ये? Fossa ना? So this is nothing but the supraspinatus fossa. ये कौन सा बोन है सबसे पहले? Scapula. ठीक है? Scapula में ये क्या होता है? Posterior aspect पे spine. ठीक है? स्पाइन के ऊपर वाला गड्ढा जो होता है उसको क्या बोलते हो? सुप्रास्पाइनेटस फोसा. नीचे वाले गड्ढे को क्या बोलते हो? इंफ्रास्पाइनेटस फोसा. दिस इज ऑन द डॉर्सल एस्पेक्ट. ठीक है? वेंट्रल एस्पेक्ट पे भी एक गड्ढा होता है. दैट वेंट्रल एस्पेक्ट वाला गड्ढा इज कॉल्ड एज सब स्कैपुलर फोसा. ओके, दैट वेंट्रल एस्पेक्ट वाला डिप्रेशन इज नोन एज सब स्कैपुलर फोसा. Important, the muscle which is present in supraspinatus fossa will be called as supraspinatus muscle. Okay, the muscle which is present in the infraspinatus fossa will be called as infraspinatus muscle. The muscle which is present in the subscapularis fossa will be called as subscapularis muscle. And lastly, the muscle one important which arises from the lateral part of scapula is known as teres minor muscle. All these muscles together are called as rotator cuff muscles. Rotator cuff muscles are responsible for movement at the shoulder joint. They will also give stability to the shoulder joint. They will be written as SIDS. Okay, ऐसा क्यों लिखना है? Because teres major है या teres minor है? Teres minor is a part of rotator cuff muscles. No issues with this. So S for supraspinatus, I for infraspinatus, small t for teres minor, and last S for subscapularis. Subscapularis अलग क्यों लिखना है? Because this is known as forgotten muscle of the rotator cuff. Previous year question. Which among the following is called as the forgotten muscle of the rotator cuff? Answer should be subscapularis. कोई दिक्कत नहीं है इसमें. Important. Now जल्दी से बताओ. Supraspinatus is responsible for away from the body ले जाता shoulder को, that is called as abduction of shoulder. Okay, abduction. Infraspinatus is responsible for infraspinatus, better term. कोई तो बोला अभी. Internal rotation. Next, teres minor is responsible for external rotation, and subscapularis is responsible for. It is responsible for adduction में मदद करता है, ठीक है, but mainly it is responsible for internal rotation as well. Medial rotation भी बोल सकते हो, ठीक है. No issues with this anybody? So now 0 to 15 degree abduction is done by. Abduction मतलब away from body or towards the body. So 0 to 15 degree abduction is done by supraspinatus muscle. 15 to 90 degrees done by deltoid muscle. 15 to 90 degree by deltoid muscle. And above 90 degree also called as overhead abduction. Overhead abduction is done by trapezius and serratus anterior. Please remember, ठीक है, it is known as trapezius and serratus anterior. तो जल्दी से 0 to 15 degree supraspinatus, 15 to 90 degree deltoid, above 90 degree trapezius, and second serratus anterior. No issues with this anybody? So that's important. Deltoid is innervated by, very good. So please remember 0 to 15 degree तो मैंने बता दिया, it is nothing else but the supraspinatus. ठीक है. Next 15 to 90 degree was your deltoid, and deltoid is very important muscle. Deltoid is innervated by which nerve? Axillary nerve. Root value बताओ फट से. शाबाश. C5 and C6. So root value of axillary nerve is C5 and C6. Axillary nerve innervates deltoid. Along with that, it also innervates. There is major या minor? Teres major. ठीक है, important. Next important, above head more than 90 degree abduction is caused by trapezius. Along with trapezius by serratus anterior. Okay, serratus anterior is innervated by or supplied by which nerve? Long thoracic nerve. Okay, please remember, long thoracic nerve, also known as nerve to serratus anterior, also known as nerve of Bell. If there is defect or injury to the nerve of Bell, it causes swinging of scapula in the patient. कोई दिक्कत नहीं है, please remember. So supraspinatus muscle is responsible for which action of the shoulder joint? Abduction. So answer should be option number A. Question number 10. A 34-year-old woman presents after 6 weeks of delivery. Okay. After 6 weeks of delivery, matlab she is in which phase? Very good. She is in the lactation or the breastfeeding phase usually. She wants contraception for the next kitne time? 3 years के लिए. What will be the best contraceptive in this case? Normally, the contraceptive of choice during lactation period, normally progesterone only pills. Okay, so the contraceptive of choice usually during lactation or during breastfeeding is progesterone only pills. But if a patient takes long-term hormones like progesterone only pills for a very long period, like 3 years, the patient will be at a higher risk of developing multiple diseases or cancers. That's the reason why we will not give progesterone only pills for a longer duration of time. We will give what? Copper T IUCD. That will be the best one for long-term contraception, even in a lactating or a breastfeeding female. This was a previous year question. No issues with this, anybody? That's important. Now, important is the condoms or any type of barrier contraceptive, whether it is male condom, female condom, vaginal diaphragm, vaginal sponge, all of them have a very high failure rate. Failure rate is calculated by which index? Pearl index. So they have a very high Pearl index. That's the reason why, along with barrier contraceptives, we always need to use a spermicidal jelly. What is the chemical inside spermicidal jelly? That was your previous question. That is known as non-oxynol 9. So the chemical inside spermicidal jelly is known as non-oxynol 9. Recent question. Kiski image di thi? Today. Today is a brand name for vaginal sponge. And the question was, the particular given contraceptive is infused with spermicidal jelly. The chemical which is present in spermicidal jelly is known as. Answer was directly non-oxynol 9. Recent June 2022 का question है ये. ठीक है? So please remember that. No issues with this anybody? Male contraceptive pill. ये पहले पूछा जा चुका है एक बार. Only one male contraceptive pill we have. What is that called as? Hmm? Very good. It is known as Gaussipol. Only one male contraceptive pill is known as Gaussipol, and it is derived from Chinese cottonseed oil. Okay, it is derived from Chinese cottonseed oil. Important is this Gaussipol is not used routinely because 10% cases can cause azoospermia permanently. ठीक है, स्पर्म बनना ही बंद हो जाएंगे 10% केसेस में. ठीक है, तो अगली बार लेने से पहले सोच लेना. ठीक है, नो इश्यूज विद दिस. नेक्स्ट इंपॉर्टेंट टेस्ट फॉर इमरजेंसी कॉन्ट्रसेप्शन. Emergency contraception is also known as emergency contraception is also known as. अरे भाइयों, इमरजेंसी कॉन्ट्रसेप्शन को और क्या बोल सकते हो? क्वेश्चन में क्या पूछेंगे? इमरजेंसी कॉन्ट्रसेप्शन को और क्या बोला जा सकता है रे? कोई बोल रहा है क्या? Interception. So they will ask you what is the drug of choice for interception, what is the drug of choice for emergency contraception, or what is the drug of choice for post-coital contraception. Interception पूछा जाता है mostly. They will not ask emergency contraception. They will ask interception. Interception is nothing but emergency contraception. Please remember that. ठीक है? And what is the drug of choice for emergency contraception? It is LNG pills. That is levonorgestrel pills. Famous by unwanted 72. Why? Because this levonorgestrel pills should be consumed within 72 hours of unprotected sexual intercourse. Please remember, how many pills should be taken? यहाँ पे one आती है. The recommended regime is 2 pills. 1 plus 1 pill usually. And there should be a gap of 12 hours in between. One pill should contain 0.75 mg of levonorgestrel. So the total dose will be, nowadays there is a single tablet of 1.5 mg, but usually the recommended regime is 2 tablets of 0.7 mg with a 12 hours gap. Both should be taken within a span of 72 hours usually. That is the drug of choice for emergency contraception or interception. But if they ask you which is the best way or which is the most effective method of emergency contraception, very good. So the most effective method of emergency contraception is nothing but IUCD, intrauterine contraceptive device. Important is IUCD. First generation IUCD was called as Lippes loop, and second which ring? Grafenberg's ring. Both of them are not used because of high failure rate. Second generation IUCD are coated with metals, and these are nothing else but copper Ts usually. The most common copper T which is used, so it is copper T 380A. How will you differentiate copper T 380A from 220B? Shabash. Important is copper stands for the metal Cu. T stands for the shape of the IUCD. It is T shape. 380 stands for what? This was the question. It is the surface area of the metal or the surface area of copper. This was the question previous year. 380 signifies what? 380 millimeter square is the surface area of copper used in the IUCD. And A, B or C, it signifies the length of the vertical limb. So चलो ये याद मत रखो, चल जाएगा. But at least remember 380A because it is a previous year question. Important is this is the most commonly used IUCD in the Indian healthcare or the Indian family planning program. कैसे differentiate करना है? अब ज्यादा copper है ना, तो usually it will not only have copper on the vertical limb, it will also have copper on the horizontal limb. जिस IUCD में horizontal limb पे भी copper है, that is 380A. ठीक है? So that's the important thing to recognize. All IUCDs usually or copper Ts have a shelf life for duration of how many years? 3 to 5 years. Most of the IUCDs will have a shelf life of 3 to 5 years. Copper T 380A is the one which has a shelf life of 10 years. Copper T 380A, which has a shelf life of long 10 years itself. Third generation IUCDs are coated with hormones. And which hormone? Progesterone. Which form of progesterone? Levonorgestrel. And those are called as progesta. तो मैंने तो तुम्हें easy दिया है. In the exam, they give Progesta cert. Now, problem was कि Progesta cert is also hormonal IUCD and POPs are also hormonal. तो क्या mark करना है? तो भी हमने Progesta cert mark करना है. ठीक है? So that's important. So Progesta cert usually is one, and second one is Mirena. Second one is known as Mirena. These are third generation IUCD. Both are coated with levonorgestrel. Okay. And again, a previous year question. What is the rate of release of levonorgestrel every day? Rate of release of levonorgestrel or progesterone every day. Previous year FMG question. Shabash. 65 micrograms per day. Okay, so the rate of release of progesterone or levonorgestrel from the IUCD is 65 micrograms per day. And last one, ये माला and माला D क्या है? It is COCPs. एकदम डिटेल के साथ बताया, ठीक है? So definitely it is COCPs, that is combined oral contraceptive pills usually. How many pills do we have? COCPs 21 pills and 7 tablets of iron. Iron कौन सा? Ferrous fumarate बच्चों. Okay, in mala and mala D the iron is present in the ferrous fumarate form. कितना mg? 60 mg. Okay, so 60 mg of ferrous fumarate is present. What is the role? ये question थे तुम्हारा. Why iron tablets are present in COCP packet? First of all, it will cause what? It will lead to continuity of cycle. क्यों? अगर तुम फीमेल को बोलोगे 21 दिन दवाई लो और वापस छोड़ दो, कंटिन्यूटी रहेगी क्या साइकिल में? She'll forget to take it after 7 days. Therefore, to maintain the continuity of the cycle. First reason. Second, to cause withdrawal bleeding usually, because when she will stop COCPs, then she'll get menses. If she keeps on taking COCP, उसको menses आएंगे क्या? Menses are due to progesterone withdrawal. तो जब बंद करोगे तब menses होते हैं. COCPs देने की वजह से menses नहीं होते, याद रखना. COCPs बंद जब करते हो तब menses होते हैं due to progesterone withdrawal. This was again a previous question of obs-gynae, that menses occur due to withdrawal of progesterone was the answer. A lot of people marked it as withdrawal of estrogen. No, it is withdrawal of progesterone. Please remember that. Okay. Second reason is that withdrawal bleeding के लिए. And third is to prevent anemia in the patient. ठीक है? So that's the important thing. Now, COCPs usually combined oral contraceptive pills contain two things. Combined इसीलिए बोला जाता है because they contain estrogen as well as progesterone. Estrogen in the form of ethinyl estradiol and progesterone in the form of levonorgestrel. How much is ethinyl estradiol? 30 mcg, that is 30 microgram. This was a question. पूछा गया है कितना? So ethinyl estradiol 30 micrograms and levonorgestrel 150 micrograms. Please remember. So ethinyl estradiol कितना? 30 microgram and levonorgestrel कितना? 150 micrograms. Okay. COCPs can also be used for emergency contraception or interception, right? But they should be used within a span of 72 hours itself. कितने tablets? 4 plus 4. So total 8 tablets should be taken with a gap of 12 hours in between, and they should be taken within a span of 72 hours. Important is this is known as which regime? Very good. UTSP and Lancer regime. Now please tell me that only two methods which are effective for up to 5 days for emergency contraception. One is IUCD, second is ulipristal acetate, also known as ELA. Okay? So one is IUCD and second is ulipristal acetate, also known as ELA. It is nothing but high dose of estrogen. That's it. Okay. Now please remember one thing, which is the only non-steroidal contraceptive pill in Indian family planning program. Non-steroidal contraceptive pill in the Indian healthcare program. Saheli, but the new brand name is Chaya. Okay, so it has got a new brand name known as Chaya. So Chaya, also known as Centroman tablets. Centroman tablets are the only non-steroidal ones. Okay, उसमें SERM होता है, selective estrogen receptor modulator, known as ormeloxifene. This was a previous year question. What is that drug present inside Chaya? Answer was ormeloxifene. Weekly tablet होती है ये. Okay, it is a once a week pill used that has to be taken. Sorry. And the only injectable contraceptive in the Indian family planning program. Antra. Very good. It is DMPA, that is depomedroxyprogesterone acetate. Another question. DMPA का dose कितना है? 150 milligram once every 3 months. Shabash. It is an intramuscular injection. So non-steroidal ormeloxifene या Chaya, important, Centroman भी बोल सकते हो. Only injectable Antra, also known as DMPA, 150 milligram intramuscular injection once every 3 months. कितनी है इसमें? So remember that. Okay, so एक दो कर लेते, एक बजे break ले लेते फिर, ठीक है? Patients from different age groups from a village in West Bengal came to clinic with illness. On examination, it is noted that all of them were having edema. On history taking, it was found they were consuming mustard seeds bought from the same local shop. What is the most probable diagnosis? Very good. Mustard seeds में क्या मिलाया जाता है? Mustard seeds तो are normal. What is the adulterant then? So very good. The adulterant is nothing but the Argemon mexicana seeds or oil usually. ठीक है? So Argemon mexicana seeds can be mixed with mustard seed, or Argemon mexicana oil can be mixed with mustard oil. ठीक है? And that can lead to a disease or adulteration disorder in patient, and that is what is known as epidemic dropsy. And the toxin which is responsible to cause this disease is known as sanguinarine. Okay, the disease causing toxin is known as sanguinarine. Patient will be characterized by edema. Along with edema, the patient will have glaucoma. The patient will have CHF, congestive heart failure, and finally death. Edema होता ही CHF की वजह से. Please remember that. ठीक है? So that you need to remember properly. Now in endemic ascites, what is the toxin responsible? Toxin I'm asking. Shabash. Pyroresidin alkaloids. So the toxin responsible in endemic ascites is nothing but pyroresidin alkaloids. And what is the adulterant which has this pyroresidin alkaloid? क्या होता है वो adulterant? क्या mix करोगे? वो ये तो नहीं बोलेंगे ना कि pyroresidin alkaloid. Question में ये बोलेंगे क्या? वो नहीं बोलेंगे. Question में वो क्या बोलेंगे? कुछ तो mix किया गया था खाने में. वो क्या mix किया गया था बच्चों? Crotalaria plant, which is commonly used for food preparation in the central parts of India, MP, Chhattisgarh. Okay? So this Crotalaria plant, which is there usually, it contains pyroresidin alkaloids, and that is known to cause which adulteration disease? Endemic ascites. Please remember this. Okay? Lathyrism, next important. Lathyrism, the toxin responsible is known as BOA. BOA is nothing but beta oxalyl amino alanine. So BOA causes which adulteration disease? Lathyrism. And BOA is present in kesari dal. BOA is present in kesari dal, and this kesari dal is mixed with अरहर dal or tur dal. ठीक है? तो तूर या अरहर दाल में mix करी जाती है केसरी दाल, and that contains a toxin known as BOA, and that causes lathyrism in the patient. Lathyrism can be neurolathyrism or osteolathyrism. In humans we have neurolathyrism, which is common. मतलब क्या होगा patient में? Muscle weakness और paralysis हो जाएगा patient में. ठीक है? So that what happens. And last is aflatoxicosis. Aflatoxicosis is due to which toxin? Aflatoxin. Aflatoxin are released by which fungus? Shabash. Shabash. This was the question. It is released by Aspergillus flavus. Okay. It is released by Aspergillus flavus. Please remember that. And usually aflatoxicosis is seen in which industry workers? Sarkari question. Groundnut industry workers. Okay, it is usually seen in groundnut industry workers. And aflatoxicosis in a patient is known to cause which cancer? Hepatocellular carcinoma or liver cancer. Okay, so and last one important, ergotism. Ergotism is due to which toxin? नाम में ही है ergot toxin. Ergot toxin is derived from which fungus? Claviceps purpura. It is derived from Claviceps purpura, which will infect the grains. अगर तुम धान या grain जमा करके रखते हो, उसमें infection होगा Claviceps purpura का, and that causes ergotism in the patient. ठीक है? तो जल्दी से एक बार adulteration diseases fixed एक question in 4-5 में से. Fix एक. This is a sure short question of your exam. ठीक है? हर exam में जाके देख सकते हो. Every time there's one question from PSM from this adulteration disorders itself. जल्दी से endemic ascites में the toxin responsible is known as pyroresidin alkaloid, and the adulterant is Crotalaria plant. In lathyrism, the toxin responsible is known as BOA, beta oxalyl amino alanine, and the adulterant is known as kesari dal. Epidemic dropsy, the toxin responsible is known as sanguinarine, and the adulterant is Argemon mexicana, seeds or oil, and that is mixed with mustard seeds or mustard oil. Last is aflatoxicosis. Toxin responsible is aflatoxin, derived from which fungus? Aspergillus flavus. It is seen in which industry workers? Groundnut industry. Which cancer it causes? Hepatocellular carcinoma. Last is ergotism, derived from like the toxin is ergot toxin, derived from which fungus? Claviceps purpura. Question number 12. In a country with low births and high deaths, okay, in a country low births and high deaths were reported, which stage of demographic cycle will be present in this patient? There are 5 stages in the demographic cycle of a country or in the demographic transition model. Stage 1 में क्या होता है? सबसे पहले remember इंडिया जब आजाद हुआ तब क्या होगा? Okay, when we got independence, what was our state? Crude birth rate was high and crude death rate was high. So definitely our population was stable. That means stationary. Therefore, stage 1 will be called as high stationary stage. So stage 1 is high stationary stage. Now in stage 2, we worked on our healthcare facilities. अगर हमारे पास hospitals हो गए तो our crude death rate went down. Our crude death rate was decreasing, but the crude birth rate was still high. Therefore, the population gap started widening. ठीक है? This will be called as early expanding stage. This is known as early expanding. So stage 2 is known as early expanding stage. Stage 3 में क्या हुआ? Now we also launched a family planning program. तो क्या हुआ? Crude birth rate also started declining, and the crude death rate due to improvement in health facilities was already declining. Therefore, this is called as late expanding stage. This is known as late expanding stage. Then we have stage 4. In stage 4, what has happened now? Crude birth rate is also declining and crude death rate is also declining. This is called as, now population will be stable. दोनों equal proportion में घट रहे हैं. So therefore this will be called as low stationary stage. And lastly stage 5. यहाँ पे क्या होता है अभी? Crude birth rate is declining. Crude death rate is declining. But which is declining more? Crude birth rate is declining more. As crude birth rate is declining more, what will happen? The population gap or the demographic gap will be ulta, inverse. Our population will start decreasing. So therefore, this will, stage 5 is called as declining stage. So high, okay. So important is high deaths and low births are seen in हाई डेथ्स एंड लो बर्थ्स. अगर दोनों को कंपेयर करूं मैं, दोनों डिक्रीज हो रहे हैं, बट ज्यादा कौन डिक्रीज हो रहा है? बर्थ रेट. तो बर्थ रेट कम है और डेथ रेट उससे ज्यादा है. तो सॉरी, बर्थ रेट ज्यादा है और डेथ रेट कम है. ठीक है. सो लो बर्थ एंड हाई डेथ्स वर रिपोर्टेड. विच स्टेज ऑफ डेमोग्राफिक साइकिल होगा ये? डिक्लाइनिंग. इंपॉर्टेंट वन लाइनर क्वेश्चन जल्दी से. द डिफरेंस बिटवीन crude birth rate and crude death rate is known as demographic gap. Demographic gap is nothing else but the growth rate of a country. Important question. Maximum demographic gap is seen in stage 2. Okay. So maximum demographic gap is seen in which stage? Late stage 2. Minimum demographic gap is seen in first and second. Okay. So sorry, first and fourth. Minimum demographic gap is seen in stage 1 and stage 4, and negative or inverse demographic gap is seen in, very good. So inverse or negative demographic gap is seen in stage 5. That is your declining stage, जहां पे death rate ज्यादा और birth rate कम है population का. तो population की size क्या हो जाएगी? कम होती जाएगी. That is what is the negative demographic gap or inverse demographic gap. Okay, so maximum demographic gap, late stage demographic gap, stage 1 and stage 4, because the population is stationary. And negative or inverse demographic gap, stage 5. India is currently in which stage? India is in stage 3, that is late expanding stage. कोई दिक्कत नहीं है. Take a break. Let's meet after a break. Lunch break ले लो. Do you want it? चलो ठीक है, lunch break ले लो. Let's meet after 45-50 minutes. ठीक है? Sure.